Welcome to this third slideshow that explores the hidden history of anesthesiology. American medical science was surprisingly sophisticated at the turn of the previous century. There were rapid advances in respiratory physiology, anesthesia, vaccines, and other medical specialties. Today, George Washington Crile is mostly remembered for founding the Cleveland Clinic and performing the first successful blood transfusion, but he should be remembered as the father of modern anesthesia and one of the most important physicians in history. He attended Worcester Medical College, which later became part of Case Western Reserve. He was inspired by the lingering death from shock of his best friend in medical school after a streetcar accident necessitated amputation of both his legs. He toured Europe after medical school to learn the latest medical advances. He became a busy trauma surgeon. He performed extensive research in an animal lab built with his own funds to determine the cause and cure of shock. He married the niece of Mark Hanna, who was one of the wealthiest and most powerful political figures of his day. He was appalled by war, but served as a medical officer in the Spanish-American War and World War I. Crile's accomplishments seem astonishing in retrospect. He accomplished the first successful blood transfusion by sewing the artery of the donor to the vein of his brother, as intravenous needles and catheters had yet to be invented. He introduced blood pressure and pulse rate monitoring to surgery, invented cardiopulmonary resuscitation, and discovered the utility of epinephrine. He established nurse anesthesia training. He showed that blood transfusion effectively treats shock, but crystalloids accumulate harmfully in bowel tissue. He demonstrated that morphine in huge doses effectively treats sepsis and peritonitis. He invented an advanced anesthesia system and introduced new surgical instruments and techniques. Crile clearly understood that occult nervous activity plays a pivotal role in surgical morbidity and mortality. He recognized that anxiety, pain, and fear undermine surgical outcome, and he introduced pre-medication, early hospital admission, and delayed hospital discharge to minimize these problems. He added prilocaine tissue infiltration and intramuscular morphine to general anesthesia to optimize surgical outcome. Crile called his technique ANOSI association, but today it is known as balanced anesthesia. He published numerous papers and books. Sadly, Crile's priceless contributions are nowadays mostly abandoned and forgotten, even though modern research has repeatedly confirmed his findings and none of his ideas have been refuted. Crile demonstrated that surgical outcome is improved by adding analgesia to general anesthesia to control the occult nervous activity induced by surgical stress. Intravenous access was unavailable in his day, so he infiltrated tissues with prilocaine before incision. When this was impractical, he administered intramuscular morphine in divided doses to reduce respiratory rate to between 8 and 12 breaths per minute. Modern evidence has clarified and confirmed Crile's observations. Painful sensations, called nociception, are conducted via peripheral nerves from peripheral pain sensors, called nociceptors, to the spinal cord. The spinal cord transmits nociception to sympathetic ganglia as well as the brain. The brain interprets nociception as pain. Anesthesia abolishes the ability of the brain to interpret nociception as pain. However, anesthetic agents do not inhibit spinal cord pathways that activate sympathetic ganglia and release harmful hormones during surgery. Morphine analgesia inhibits spinal cord nociception, which explains why adding morphine to general anesthesia improves surgical outcome. Yandell Henderson was the director of the Yale Laboratory of Applied Physiology and the most prominent expert in gas physiology in his era. Like Crile, he was an idealist who believed that science should serve the public interest. He opposed American involvement in World War I. He testified before Congress about the dangers of automobile exhaust pollution, though his views were not accepted until long after his death. In 1911, he famously led a group of international experts that studied respiratory physiology at the top of Pike's Peak. His research demonstrated that hyperventilation during anesthesia is potentially lethal, while CO2 supplementation stimulates respiratory drive, enhances cardiac efficiency and tissue oxygenation, and prevents postoperative atelectasis, pneumonia, nausea, and vomiting. As in the case of Crile, his important research findings are nowadays mostly ignored, and even though they have been repeatedly confirmed by modern research, and none of his work has been refuted. Henderson also demonstrated that CO2 supplementation effectively treats myocardial infarction, angina, strokes, pneumonia, asthma, influenza, breathing problems in newborn babies, carbon monoxide poisoning, drowning, and smoke inhalation. He inspired the installation of Carbogen, which was a mixture of oxygen and carbon dioxide, on fire trucks in New York City, Chicago, and other major cities. Carbogen was widely embraced by physicians. It was credited with saving many lives, but unfounded fears of CO2 toxicity caused it to disappear from use. John Silas Lundy was the chairman of the Department of Anesthesia at the Mayo Clinic. He established an early anesthesia training program, and he trained Dr. Ralph Waters and later helped Dr. Waters establish the anesthesiology profession. He introduced intravenous barbiturate induction, ventilators, ventilator vests, oxygen tents, and nasal oxygen. He demonstrated that carbon dioxide supplementation accelerates ether induction. He developed anesthesia machines, needles and syringes for spinal anesthesia, and the concept of balanced anesthesia. He established the first blood bank, the first anatomy lab, and the first recovery room. He produced numerous papers and a textbook of anesthesia. Dennis Jackson was a pharmacist. The onerous cost of medical gases inspired him to invent closed-circuit circle system anesthesia machines that became the precursors of modern anesthesia machines. He built his own workshop and tested his prototypes on his pet dogs. Numerous competing machine designs appeared during this era, but Jackson's machines quickly gained dominance because they minimized gas waste, reduced explosion hazards, enabled respiratory assistance, and facilitated CO2 accumulation. Jackson's closed-circuit machines minimized gas waste because the patients rebreathed the gas mixtures within the machines, and oxygen was added as needed to replace oxygen consumption. Note the milk bottles that contained liquid sodium hydroxide to absorb carbon dioxide in this early Jackson prototype. This necessitated an electric motor to force the gas mixture through the sodium hydroxide. Fortunately, these motors never caused an explosion, and the liquid sodium hydroxide was soon replaced by soda lime, and the milk bottles and the motors were eliminated. Early anesthesia practitioners added bypass valves to Jackson's closed-circuit anesthesia machines to isolate soda lime from the breathing circuit and accelerate CO2 accumulation within the machines. They also employed external CO2 tanks for carbon dioxide supplementation. This graph illustrates the opposing effects of morphine and carbon dioxide supplementation on respiratory drive. Carbon dioxide stimulates respiratory chemoreceptors and enhances respiratory drive, so that respiratory rate and depth is primarily regulated by CO2 tissue levels. Morphine reduces respiratory chemoreceptor sensitivity and reduces respiratory drive. Hyperventilation depletes CO2 tissue reserves, reduces chemoreceptor activity, and reduces respiratory drive. Therefore, hyperventilation is incompatible with morphine treatment, but CO2 supplementation enhances morphine tolerance and enables large doses of morphine to be safely administered during anesthesia. Early anesthetists faced long-forgotten difficulties. Their inhalation agents were smelly, slow, and explosive. They lacked intravenous access, so they could not utilize intravenous drugs. and without intravenous drugs, intubation remained time-consuming and difficult, and most cases were managed by mask with spontaneous breathing. They quickly embraced Jackson's new anesthesia machines and the research of Crile, Henderson, and Lundy to evolve a sophisticated anesthesia technique. They used intramuscular morphine premedication to mitigate anxiety, obtund the obnoxious odor of ether, and control surgical nociception to prevent occult sympathetic nervous system hyperactivity and postoperative morbidity, mortality, and pain. They used carbon dioxide supplementation to accelerate ether induction, speed emergence, stimulate breathing, enhance cardiac efficiency, offset morphine respiratory depression, and optimize morphine dosage. Carbon dioxide also enhanced tissue perfusion and oxygenation and prevented postoperative nausea, vomiting, respiratory depression, atelectasis, and pneumonia. The Crile-Henderson balanced anesthesia technique enabled superior surgical stress control, but it had serious shortcomings. Without muscle relaxants, intubation was difficult, and muscle tension often caused surgical inconvenience. Without endotracheal intubation, there was constant threat of airway obstruction, laryngospasm, vomiting, and aspiration, and many types of surgery were impossible. On rare occasions, patients would unexpectedly develop convulsions, fever, cyanosis, and profuse perspiration, often succeeded by death. This baffling Dr. Jekyll, Mr. Hyde phenomenon was initially attributed to fever or occult medical problems, but the causative role of CO2 was soon recognized, whereupon it became known as the CO2 toxicity syndrome. Regardless, practitioners were reluctant to abandon the compelling benefits of CO2 supplementation. It is time for another intermission. The next slideshow will explain how Dr. Ralph Waters founded the anesthesiology profession on the basis of a practical new technique that introduced mechanical hyperventilation to eliminate CO2 toxicity. The superior stress control of the old Crile-Henderson technique was soon forgotten, and the Waters technique became standard practice throughout the world. However, the Waters technique introduced occult new problems and hazards that are only now becoming belatedly evident.